So hair transplantation is not just about moving hair from the donor ear to your recipient area. So this is not really rocket science. If you just wanted to move hair from your donor ear to the recipient area, that's not rocket science. I think I could teach nearly anyone to do that maybe in 6 months, 8 months. But what you really need to understand is, does this patient even qualify for having a hair transplant? Is that the right solution? And if it's not the right solution, what that? And even if it's the right solution, how many grafts should we transplant today? What do we expect is going to happen in 3, 5, 10 years from now? Will the hair loss progress? How is the donor ear going to develop? What is likely causing the hair loss? Could it be because of copper deficiency or zinc deficiency? Could it be because the patient is taking vitamin A for acne, for instance? So, what is the medical part of the hair transplant aspect and hair loss treatment? What is the medical aspect of hair transplantation or treatment for hair loss? It's not really the execution itself. That is still a minor issue. The bigger question is understanding what brought the patient to this stage, what caused the hair loss. Do we need to do any investigation? Could there be any issues with the scalp? What is going to happen 10 years from now? Would this hairline that we are designing today, would this look natural 5, 10, 20 years from now? So understanding those things are really where the medical training, understanding, experience, skills come into play. And I have too many patients where I need to repair a previous surgery because the doctor or the technicians in many clinics is just technicians doing the surgery without any involvement of the doctor, because they didn't really understand the dynamics of hair loss. They didn't understand how the hair loss would develop over the next years, how the donor area would change, how the hair loss would progress, how the design would look. And patients lose a lot of trust in doctors once they've had a very bad experience. So I think it's very important that we understand hair transplantation technically is not hard if you just want to move hair from one place to another. If you want to do a hair transplant with natural results, then it requires skills. If you want to understand why the hair loss was there, it requires medical knowledge. It requires you to understand what is the likely factors that are driving this hair loss. So that is where it really is important that you're speaking to someone who is professional in their field and not just someone who can take hair from one place, put it in somewhere else. And coming back to that, a lot of clinics are run by technicians. There's no doctor involved, there's no supervision. The doctor may, even if the doctor is involved in some cases, the doctor is not trained in hair transplantation. He just signs off on the books. He is on the record to be the doctor. But if the doctor hasn't gotten any experience, if the doctor hasn't gotten any training, doesn't understand what he or she is doing, and leaves everything to technicians, maybe with even many years of experience, in that case, you could end up with a very poor result. If you're suffering from hair loss, it's very important to understand what are the options for treating your hair loss. You could have a medical treatment, you could have a surgical solution, or you may also combine it. And then there's another solution also that I'm going to talk about in just a few minutes, something called functional medicine. With medical treatments, we have PRP, we got PRGF, plasma-rich growth factors. If you're suffering from hair loss, there are a number of options you can consider. You can consider medical treatment, you can consider hair transplantation, and finally also something called functional medicine. So let's walk through these options one by one. In the medical treatment, the non-surgical treatment, we conventionally talk about different kinds of therapies to the scalp, or it could be medicines. In some cases also prescription medicines.